Today, I'm going to discuss with you chin enhancement, either with facial fillers or more permanent solutions like chin implants. Previously, I've discussed brow lifting, blepharoplasty or cosmetic eyelid surgery, facelifting, and neck lifting. The last area I think we should focus on in particular, is the chin and how it can influence the overall aesthetic of the face. So before we discuss the ways to enhance the chin, I think we should backtrack and think about what's called the golden ratio of the face. Because as a facial plastic surgeon, a patient coming to me, I look at their face and I say, well, how can I balance their face and enhance their beauty? First, I look at the vertical dimensions of the face, and it's really divided into thirds. So what we look at is the distance from the hairline to the brow area. That's about a third. From the brow to the lower part of the nose is another third, and the distance from the lower part of the nose to the chin is another third. If this portion is less than the other portions in terms of the vertical dimensions, we then can start talking about how to lengthen that dimension. I don't look at just the vertical dimensions of the face. I also look at the profile of the patient. So looking on the profile view, we can see that sometimes the nose may project further out relative to where the chin is, making the nose actually appear much larger than it actually is. By balancing the chin and enhancing the chin, we can then balance this proportion between the tip of the nose and the tip of the chin. So before we talk about the different options on how to enhance the chin, I think we have to talk about the difference between male and female chins. In general, male chins tend to be more wider and squared off relative to what a female ideal chin appears to be, which is more heart-shaped. So that can influence how we either inject the filler or the kind of implant we choose later to use. I like facial fillers as an option for those people who are unsure whether or not they want to have a more permanent solution to enhance their chin. So if a patient comes in and wants chin enhancement and is unsure whether or not they want a more permanent solution like a chin implant, I offer them a injection of facial fillers like Juvaderm or Restylane. That can last about 9 months to a year, and they can get used to the idea of what the image of an enhanced chin looks like. And if they're comfortable with it, they'll proceed to have a more permanent solution, or they may just want to have a repeat of the injection itself. Now, obviously, having a chin implant is a surgical procedure, and it comes with some risk, although they're minimal, but there are some risks associated with surgery. And therefore, some people say, I just want to have an injection, Dr. Kopelman. I don't want to go any further than that. That's fine with me. The other beauty of facial filler, of course, is that it can be reversed. Even within a few days, if you don't like the way it looks, it can be reversed with hyaluronidase, which is an enzyme that breaks down the injectable. So there is a place for facial fillers in terms of offering the patient different options in terms of chin enhancement. So if you're thinking about a chin implant, what I do in the office is to evaluate the size, shape, and projection of what you require to enhance your chin and get a balanced overview of your face. So some of these implants come thicker, and you can see the thickness of them. And of course, they come extended, which usually fills in what's called a pre-jowl sulcus, which is like this little depression over here. They can be modified. These are made out of plastic, so that sometimes they're trimmed at the top, or the ends. These little flanges on the end can be trimmed off depending on how far out you want to trim the implant. So we kind of customize these implants. At the time of surgery, however, what we do is we take actual sizers, which are non-permanent, and we just insert these through the incision below the chin right here, and insert these sizers and to determine on the table whether the preoperative evaluation of the patient was correct in terms of the size and shape. And sometimes we modify the size that we actually insert at the time of surgery. So sometimes we say, oh, I think the patient is going to need a medium-sized implant, but they end up having a small implant inserted, because once it's under the skin on the table, I evaluate the projection of the chin relative to the nose, and also the width of the chin, and I determine whether or not that is the correct size that will give harmony and balance to the face. If you're considering having a chin implant, it can be done, believe it or not, under local anesthesia, or you can go under IV sedation or general anesthesia to have it done. Depends on your level of anxiety regarding surgery. So if you want to be totally asleep, then you need sedation. But very often we can perform this procedure as a standalone procedure under local anesthesia, which means that you can go home immediately following the procedure without almost no recovery time. Now, the way the procedure is actually performed is that there's about a 1.5 millimeter incision, small incision, below your chin, along the crease below your chin. The implant is, as I said, we use sizers to first size out the correct size of the implant we're going to use, and then we withdraw that and then horseshoe the implant in on each side like so, and so it sits right on the chin like this. It's all under the skin. The incision is closed in layers. There's a capsule that forms around this implant as a reaction to the plastic implant. The body naturally creates a capsule around it and fuses that implant in place. Very, very, very uncommonly does it get displaced, and that probably would only occur, say, if there was a injury that may occur. But other than that, it's a permanent procedure, very easily tolerated as a procedure. There's very little discomfort before, after, and you will heal quickly, and the recovery is quick as well. So today I only discussed chin implants as a solo procedure, but of course chin implants are commonly combined with other cosmetic surgical procedures like facelifting, neck lifting, rhinoplasty, and liposuction of the neck. So some people have fullness of the neck, and you do liposuction at the same time you insert the chin implant, or sometimes you do a neck lift and they also need a chin implant as well. So it can be combined with other procedures, and it's safe to do so. It just has to be done under anesthesia, however. I hope you found this video to be helpful in terms of how to cosmetically improve your chin, and whether that's an injectable or permanent solution. If you have any further comments, I'm more than happy to answer your questions. Please leave them below. Please subscribe to my channel, and I look forward to seeing you again in my next video.